Did you know dentists double as detectives? They're determined to discover dental evildoers. The main suspect, decay. And our own dental detective, Steve Marsh, is here with details on how to disarm this oral offender.
Hi, Lori. Quite an introduction.
Yes, all the D's. So how can we tell if it is decay that's guilty in breaking and entering into our teeth?
Very cute. So one of the things that I always think about as a practitioner is that what happens with decay is what happens in nature itself. And I actually have some bananas here today. So what happens with a banana or most fruit, if it spoils, it turns color, it changes texture, it changes odor. All of those are signs that tell us maybe that banana isn't ripe or isn't ready to be eaten. In fact, I had 3. I ate one while we were waiting.
So it's not too unripe yet.
Yeah, but what happens with nature is what happens with the tooth. The tooth will change color. It'll change dark, brown, black. It'll change texture, and the dentist can see how deep it is and whether it's soft or hard, very much like a banana.
Okay.
You know, I was thinking, Lori, in the old days, my father, who was a dentist, started in 1932 or 33. That's about all he had to detect decay, and that's an explorer, and that's what the dentist still uses. When we look at a groove or something, we're not sure exactly whether or not it's decay. That's where we started, and then came x-rays and a lot of other wonderful new things that we can use to detect things.
Yeah, x-rays started out as just little tiny things, right?
Right. So, Lori, here's an old-time x-ray for your viewers to see. That's what the dentist, you see them, we put them up on a screen, and we look and we try to look closely. It's a little hard with the light in here, but it's about 1 inch long, and that's what we had in the old days. Today we use digital x-rays. There's 90% less radiation, and they work very well. In fact, here's a picture of a patient of mine in the office. She's looking at a complete set of x-rays. It's 18 x-rays. It's less than being in the sun for about 3 minutes. But we're also, as a dentist, able to enlarge it and look at it and change the contrast, so we can be very specific when we're looking at x-rays. Here's another fairly new instrument. It's called the Diagnodent. We have that as well. It's actually like a laser, and what we do, Lori, is we put it on the tooth when we suspect there's decay, and it gives us a reading, anywhere from 0 to 100, and it's pretty obvious.
Okay.
And this is a picture of Amy, our hygienist in our office. This is called the caries view. This is the latest piece of instrumentation to show decay. She's actually holding it in a patient's mouth, difficult to see, but it's a very high intensity light, and it has no radiation at all, and then it will show up on our x-ray screen, and we're able to see if there's decay, because not everything's so black and white, so to speak, with an x-ray. With that light, we're able to be very sure of our diagnosis.
You can pinpoint it and get it and detect it. Once you detect it, how do you destroy it?
So, you know, the same old thing, we use the drills to take it out. Now, one thing that's very important, it's sort of like rust on a car. Here's a patient of mine who came in. He was actually Lori, 22 years old. He had actually had braces, and he drank a lot of energy drinks. He was a good athlete, and it literally rotted the teeth.
Oh, dear.
So here's the picture before. The picture after is actually during the procedure. We've taken out the decay, and what we use is a dye in our office. We wipe it on the tooth to make sure all the decay is out, because just like rust on a car, if you leave any, it's not good. And there's the upper arch restored. We haven't gotten to the lower arch, but we've used composite fillings. That's a huge advance versus silver fillings. But again, just like your last earlier guest, you want to get to it before it happens.
Right.
So here's somebody else who came to me recently. He had decay. He had lost a tooth. And then the question is, how do you restore it? We went in, we took out the decay. He wanted a permanent restoration. That's all porcelain, and today our porcelains, as I've mentioned before, are very strong. They're very aesthetic. And in this case, here's a woman who had 2 crowns done many years ago. Presented very well. She was in advertising, wouldn't smile because she was ashamed of that work. Those were old crowns. We took them off. We put new porcelain crowns and veneers, removed all the decay first, and then restored the teeth with that beautiful smile. So
amazing the things that can be done to get
right. So we have to detect it, and once it's there, we have to make it beautiful and aesthetic.
All right. Thank you. Mystery is solved, but the case isn't closed until your own dental decay has been cleared. For help, give Steve a call. His number's next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com. Next.